my name is Dr. Kaylee Bantam from Cognitive Behavior Institute, and today we're going to talk about attention deficit hyperactivity disorder, or otherwise known as ADHD. So ADHD is a diagnosis that I deal with quite frequently in working with children and families. The symptoms of ADHD come into two different categories. Our first categories of symptoms fall in what we call the inattention category. Here we see things such as failing to pay attention to details, losing things, not listening, kind of appearing not to follow through with directions when told, difficulties completing tasks, problems with organization. Sometimes we see that these kids are easily distracted and forgetful in their day-to-day activities. Our second category of symptoms that we commonly see with ADHD fall under the hyperactivity or impulsive type of symptoms. These symptoms are where we see very high levels of activity, fidgeting, difficulty leaving their seats. Sometimes they appear always on the go, almost like they're driven by a motor. These kiddos can climb and run and sometimes have safety concerns. We also have difficulties with quiet activities, talking excessively, struggle pretty significantly at times with turn taking, can interrupt others, and can be a little bit intrusive in social situations just because of that impulsive control and inability to kind of stop and wait. The symptom presentation for ADHD, often we're looking for these symptoms, 6 of these symptoms in either category. When we're looking for the diagnosis, we can also look at the age range. So this is usually given under the age of 12. This is a new adjustment with the new DSM-5. There used to be a younger age, but now we're looking at by about age 12, we've seen this presentation of symptoms. The symptom presentation can also come in 3 different categories. We have a predominantly inattentive type, where we're seeing mostly those inattention symptoms, or we have a predominantly hyperactive type, where we're seeing a lot of the hyperactive or impulsive symptoms, or we may have a combination presentation, where you're getting a little bit of both and you meet criteria under both categories. Before looking into treatment for ADHD, it's important to have a thorough evaluation. For our evaluations, we want to make sure that we're looking at a thorough history in terms of symptom presentation, making sure the symptoms are seen across multiple settings, and also looking at the severity of the symptoms and that we're seeing them impacting different levels of functioning. Before addressing the treatment piece, we want to get history from the family, from teachers. We also want to take a look at administering some behavioral assessments to really get some objective key features of the symptoms so that we have that data on hand. Another way to exemplify our evaluation for ADHD is that you can have psychological testing done. And this is where there's a battery of tests administered to a kiddo one-on-one with a psychologist who's able to do so. And we look at areas of brain functioning such as attention, inhibition, executive functioning, memory, processing speeds, just to see how those different areas may also be impacted by the ADHD symptoms that may be present. This really helps us hone in on a clear diagnosis as well as tailor our treatment to meet these different needs that you may see. So when it comes to treatment, we have 2 options. So there's certainly support in the literature for medication management for ADHD, and although this may alleviate the symptoms that we see with attention deficit hyperactivity disorder, it may not address the key kind of underlying behavioral problems that may be present as well. So it's also important to integrate the behavioral therapy through intervention with the child, as well as parent management support to support those behavioral needs as well. So a combination of both is best practice. However, we also encourage families to get involved with behavioral therapy initially, and then maybe consider medication if we don't see an alleviation of symptoms. That can certainly be determined in terms of outlining your treatment plan and working with your clinician. For more information regarding an evaluation for ADHD or possible psychological testing to determine if this is an appropriate diagnosis for your child or adolescent, please contact Cognitive Behavior Institute at 724-609-5002. We also encourage you to check out our website at www.papsychotherapy.org.